Yes.
I'll push the computer back. It's a little laptop here.
Maybe it's the quality of your microphone. Your voice is very hard to understand.
So I think if I turn it down, it will help, perhaps? I think so.
Yes. I think turn down your modulation.
Does that sound any better?
Yes.
Oh, yeah.
All right. See, that's what happens when you have a tech nerd in your family. And then Dr. Bull, who's helping with the technology, actually running the technology. And so I wanted to ask everyone if they would, to avoid using acronyms like SEOC, which stands for the State Emergency Operations Center, so that all of us participating in the meeting know what we're talking about. And do you, Jim, or Tammy, want to start out with a couple of opening words? Anything you'd like to say?
I don't have anything. I'm just here to listen to what the people who are presenting have to say.
What about you, Tammy?
I would just like to say that I am glad that people are joining together and making this all happen. I know it's been a difficult time for everybody, and just being able to communicate and start figuring out ways to move forward is pretty great. So I appreciate everybody's effort. Thank you.
Yeah, I agree with that.
So just a quick outline, we're going to go to the people from the Agency of Human Services and Dr. Matthew, who are going to give us about half an hour, or maybe a little less, you'll never know. So why don't we start off with Paul Dragon?
Yes, thank you, Sasha. Thank you, everybody.
Hey, can I just interrupt real quick and let everybody know that it's being recorded?
Great.
Actually, Dr. Bull is taking care of this, and he is, of course, recording it because we are required to do that by the guidance of the Secretary of State's office. And what I would ask is that, except for the person who's speaking now, could you mute them, Dr. Bull, so that we don't get any background noise from other people? Is that
yes,
possible?
I can do that. It might be a little bit easier just at this stage if everyone could self-manage. So if you're not speaking, if you can click on the mute on your phone, or if you're on your computer, click the mute button. There should be a small icon of a microphone, and
Okay.
that greatly improves the audio quality for those who are speaking. And then when you want to say something, you can just unmute and say it, and then mute when you're finished.
So although we are doing this completely remotely, this is a select board meeting, and we will follow the normal routine. So the first person to speak will be Paul Dragon.
Well, thank you so much, Sasha. First of all, I want to thank the people of Plainfield and Washington County. I want to thank Dr. Bull and Goddard College for their generosity and openness in this adventure. And I want to thank the Select Board and the town officials. I'm sitting here at Goddard right now with Dr. Matthew. We also have Drew Resley. She's going to be the Assistant Director of the campus. We'll talk more about that. And Monica White is here joining us. She's a Plainfield person, and she is the Director of Operations for Disability, Aging, and Independent Living. So I think my remarks, the way they'll probably go is I'm just going to introduce myself and then kind of give a brief overview of the project. I do want to talk about the project, why we're here, and how the flow will happen for both guests and staff. And then I'm going to turn it over to our partner, Dr. Matthew, and he's going to talk a little bit about some of the health components to the project and the role of the health center. And then Sarah Phillips and/or Jenny Samuelson will talk about the larger context about how this fits into a statewide approach, which I think is really, really important, and how we're taking a statewide housing plan for vulnerable populations with COVID-19. We also have, I think, out there, Leslie Wisdom. I may refer to her for some questions. She is our counsel, one of our counsels at the agency. Our goal here is to leave plenty of time for questions and comments. We really want to get your ideas and thoughts, and I'm so happy this is being recorded so we can gather all your questions, and if we can't answer them now, we will answer them again. I also want to let you know that we're willing to do regular meetings, town forums, meet ad hoc, whatever is sufficient to let you know that we want to be totally responsive to you and the town and the county. So just a little bit about myself. As Sasha said, I am the director of the campus, and we'll talk a little bit about that. I've held numerous jobs over the past 14 years just within the agency of Human Services. I was also, one of my roles was deputy secretary for the agency. And for folks who don't know the agency, it's a large agency that spans all of Vermont. It has 6 departments, and it includes the Vermont Department of Health. It includes Department of Mental Health and a number of other departments. So the only reason I'm telling you that I was the deputy secretary is that I do have an understanding, at least generally, of the entire agency and the departments within it. So I did want to let you know that. I have my doctorate in education from the University of Vermont. I've never used, the closest I've come to using that doctorate of education is sitting right here at the campus. So I'm a former Peace Corps volunteer. I've got a family, 3 young adults. We live in Underhill, Vermont, and that's it. That's me. That's pretty simple. I'm the director of the campus. So I want to let you know as we go into this, we just started last week, and the work is developing fast. As you know, this is a rare time. This is a crisis, and we just got on campus last week, and we are putting all this work together. And I'm so grateful not only to the folks who have been involved from the town and the community, but to my AHS colleagues who have really stepped up in such a rapid way to help get a number of things accomplished in a very short period of time. So I want to let you know that our values going into this are transparency, open communication, and humility. As you know, we did just start. We don't pretend to have all the answers. We will take feedback. We will adjust as needed, and we want to hear your concerns and your ideas. Again, we're living at a rare time in our history. Things are moving so very, very quickly, and we plan on sharing with you our policies, procedures, the signs, and other documentation related to our work as best we can. The name right now for the campus is the Wellness and Recovery Campus at Goddard College. This will be a place of compassion and healing. In fact, we had a volunteer today already drop off a sign, a beautiful sign with daylilies painted on it, and it said, Wellness and Recovery Campus at Goddard College and place of compassion and healing. So we've already had volunteers kind of stepping up. I think it's important for you to know who will come and why. The campus is for people who have nowhere else to go, and it's for people who can care for themselves, though. In other words, they don't need assistance with medication or activities of daily living. This is the current policy. That may change, but this will be for people who can kind of manage on their own. One of our goals in setting up this campus, and I think other work that's being generated around the state, is to relieve the pressure on the hospitals. As you know, they are being overwhelmed. But we will get guests here who are appropriate for dormitory style living, a kind of shared living environment. This will include people who are experiencing homelessness. This will include people with different abilities or people who are disabled. This will include people with mental health conditions. This will include children in DCF custody, and this will include family units. So these are the folks that we're so far planning on having here. Now, one of your questions may be, how will the services be provided and who are our partners? We've had a wonderful partnership just over the past 4 or 5 days as we started with the Health Center of Plainfield. And I couldn't be more thankful to Dr. Matthew and his staff. They're going to be doing registration and screening, daily health checks, some pharmacy management, referring out to a higher level of care. And I'm going to let Dr. Matthew talk a little bit more about this when I'm done with my overview. We've worked very closely with the local emergency medical services, and I really want to thank Assistant Chief Matthew for his on-the-ground support. We've notified the Washington County Sheriff's Office, who is very supportive, as well as the lieutenant at the State Police Barracks. We also have a state partner and staff who are signing up to be residential managers and counselors living in the dorms with residents in the recovery zone, which I'll talk more about. And as you can imagine, this is a big ask. And we have developed, detailed protocols to help with their safety. They will be working in the recovery zone with people who have active COVID-19. So again, so impressed with people who are volunteering to do that work. For security at this date, we have security from 10 p.m. to 8 a.m. from the Lamoille County Sheriff's Office. They've gone through some trauma-informed training, and they had the ability, the capacity to provide that coverage. As we ramp up, we will of course consider more coverage 24/7 when needed. You might want to know how the campus is going to be configured. We have it configured into 4 zones. There will be an administrative zone. That will be a very small area. That will be completely clean and sanitized. We've already developed strict protocols for entry and exit. That'll be for our health center staff and our AHS staff. We have a recovery zone that will be for the rest of the campus, and that will be the zone for people who are active COVID-19. And again, there'll be strict protocols within that zone. We'll have a drop-off and pickup zone for volunteers and food for volunteers to come and deliver things and for food to be delivered. And then we're going to have a staff transition zone that will be within the recovery zone. And that will be a place for staff who are working in the dormitories with the kids and the adults to transition into their into their personal equipment to be prepared for working with the staff, and that will be masks, gloves, and hospital garb. Staff will wear scrubs and follow strict protocols while they're in the recovery zone. We've already done a lot creating signs inside and outside the buildings. We are also planning to post the perimeter so people know not to come onto the site. And everything we do, all our policies and procedures and all our signs that we've developed in a very short period of time will be trauma informed, as you can imagine. The folks that we have coming here, including the children, have probably experienced quite a bit of trauma in their life, and we are very fortunate to have a trauma director at the Agency of Human Services who can help us prepare all our signs, all our materials in a very thoughtful and trauma-informed way. We'll have signs inside the perimeter just for certain stations, for laundry, etc. I just want you to know that this has all been kind of detailed out. All of the signs will reinforce health and safety, of course. We'll have a sign at the front when you enter onto Pitkin Road, talking with the name of the place, saying that this is a place for recovery and compassion. We also we'll talk a little bit more about volunteer opportunities, but we welcome any kind of appropriate artwork and any other participation from Plainfield folks, Washington County folks, or anywhere over the state, all over the state, who want to participate. And we'll get more information out about volunteering opportunities and donations. There's going to be 3 major phases for guests and staff. There'll be registration and screening, daily maintenance, and discharge. Registration, just briefly, someone will call who is coming in. Again, this is for people who are COVID positive. We'll get as much information as possible. We've detailed out the way we're going to do that in a very thorough way already. Once a guest arrives, there'll be a screening, and we plan on having tablets or computers and designated phones in each of the residences where Dr. Matthew and his staff will do quite a bit of telehealth work. The daily maintenance will be when people are here, they're getting settled in, there'll be telehealth visits twice daily. These will be check-ins for residents, kind of monitoring, and for staff daily to see how they're doing, how they're feeling. That will be from the campus. The health center staff and AHS staff will be on from 7 in the morning to 7 at night, at least initially. And there will be check-ins, regular health rather regular health check-ins by the staff of the health center of Plainfield, and that can happen even from the health center or from their home, but I'll let Dr. Matthew talk more about that. Discharge will be following VDH guidelines. Once a person is safe to leave the campus, we will follow those guidelines, and certainly we're going to get you those guidelines. They're actually on the VDH website and from 3/24/2020. Happy to talk more about that, but certainly we'll get you those guidelines for discharge. Discharge will also include not only somebody who has recovered from COVID-19, but it will be done in a way that we know a person is going to a place where he or she or they will be safe. It will be a safe place to stay for them as well. So that's going to be very important to us. Medications will be on site. We'll have a resident manager to support this dispensing and logging of medications. The people will be walking around the campus. We're hoping to get activities if and when there are children here, and we want people to be able to enjoy the fresh air, and that will be done, with rules and regulations and some monitoring as best we can. There's going to be background checks performed for all staff and guests coming onto the site. And of course, we'll make our best effort to place people appropriately based on gender identification, population, medical, social, and criminal background. And I know folks are going to be concerned, particularly about discharge and how we do that, or rather somebody who is walking who may just kind of leave the site. And right now there is no statewide order of quarantine for people who have tested positive. We do want you to know that our health department, which is part of the agency, speaks with people individually who have tested positive to provide guidance and information on self-isolation procedures and safety. At the Goddard site here in the recovery zone, we'll work closely with individuals to keep them and others safe at the recovery center and let them know what their responsibility is if they do choose to leave. We're also staying in touch with the health department to seek guidance on this and other questions as they arise. And we recognize that this is a concern for a college campus in a small town, that people may choose to leave the site. In full transparency, we want you to know that there is no statewide order of quarantine for people, so we cannot at this time hold them there, but we will do our due diligence to educate people and work with them so they don't want to leave and make this a pleasant place. There will be strict standards for privacy and confidentiality, of course. We're going to follow all HIPAA guidance and preserve guest and staff confidentiality. We wanted to leave a lot of this time for questions. I am going to turn it over to Dr. Matthew. I am sorry, I'm usually not such a fast talker, but I wanted to get this in. And I really wanted to thank you. You are helping us to do something never created before, to my knowledge at least, and you're providing a great service and home for vulnerable Vermonters. So again, I want to thank the Select Board, Dr. Bull, people of Plainfield and Washington County. And now we're turning it over to Dr. Matthew.
Hi, this is John Matthew. I'm the director of the Health Center, which is in Plainfield and in our 47th year. So we have a number of services that we're going to provide for the people who come to be residents here. First of all, we have a staff that's up in the Manor House on site to do registrations and administrative functions, and a person we're calling runner who could go into town and get some supplies or some insulin or whatever. Each person who comes, besides having twice a day health checks, because these are people that are virus positive, so we've got some people that will check on how they are doing, but then each individual is going to check into our practice, register as a patient for the time that they're here. I or one of the other doctors or PAs will see them for a televisit. Then, having registered with our office that we can obtain medications for them from community health pharmacy, because these people will have come from all over the state. We can just get their meds. They'll be mailed and sometime on Wednesdays actually brought to the health center, and then we can bring them up and have them distributed to the different dormitories where various people live. If we need some short notice medications, we can get them from Kinney's and the runner can pick them up. So that gives us the opportunity to do a medical evaluation, sort of not try to alter too much about anybody's situation, but take over the provision of their medication. And then we also have a competent counseling staff with about 7 people who have a variety of skills. We're going to try to connect each of these new residents with one counselor for at least an evaluation. They might conclude that everything's stable. They might say, gee, this needs drug and alcohol counseling. We have somebody that can do that. We've got people that have dealt with adjudicated youth. We've got people that deal with families. We've got a couple of licensed clinical social workers. So we'll try to make the best match, let's say. And it might well be, I can imagine being a kid in a foster home that gets moved halfway up the state. They might very much like to have somebody to talk to. And so those counselor visits could come back, so to speak. We have a neurologist on staff, and some of these people have traumatic brain injuries. Our group's been interested in that in a long time. We have a part-time arrangement with a behavioral neurologist. And so I think we can take care of all the, let's call it psych and counseling needs of these people at the level of TV visits, phone visits, and all their medical business, and quite importantly, the pharmaceuticals. We do have a dental unit, but it's only right now seeing emergencies, and it wouldn't see somebody who's virus positive because of the risk to everybody else in the continued operation of the unit. But they can give us some advice as a dentist right now coming into our building for just emergencies. I think it's 3 days a week for the morning. We're the only emergency service for the county and maybe beyond. But they can certainly, and I've already gotten some advice, for example, about which antibiotics we would use in a particular situation. If somebody got sick enough to go to hospital, although we do our own hospital admissions, the hospitalists at the Central Vermont Medical Center are doing anybody who's virus positive, which is frankly an enormous help to us, because otherwise we would have to do a whole bunch of donning and doffing and whatnot that they're going to take care of. So we do have the ability to hospitalize somebody locally. The emergency room could see them if something came up like that. But they would be potentially hospitalized at Central Vermont Medical Center. We hope that these people just are riding along as virus positive and don't take ill. So medical services, pharmacy services, counseling services, some specialties if we needed it, some advice, but not hands-on dentistry. And so we're hoping to just do a good job of looking out for these people who are going to be a variety of people who come from all over the state. We don't intend to supplant their connections to other people that maybe, for example, their psychiatrist or their counselor somewhere else. And part of what our on-campus staff can do is facilitate, somebody setting up to be followed by, let's say, their psychiatrist in Brattleboro, just to make up a hypothetical case. So we think these people need a hand, and are part of an effort that's very smart to shelter and reduce the traffic and people who might pass this virus around. I would say I'm entirely supportive of Phil Scott's decision to tell us all to stay at home, and it's the best hope we have of not having a lot of people get sick. The other question that people have brought up is about testing and when are folk ready to leave. We're going to see what the health department has to say about that. That seems to be changing pretty frequently. We don't have the testing capacity in our house at the moment, but actually we've looked in the last couple of days into the Abbott system, which is 5 minutes to positive and 13 to negative. We heard of a system today that's 3 minutes to positive antibodies. And so we're looking into getting that capacity. We have a lab that's all inspected and licensed and all of that stuff, but this testing is just not available as yet. But in fact, if we had that set up, we could have samples, so to speak, come. Actually, the hospital may use us for some testing, that we have the same machinery. And so we might be in the position to test and say this person is no longer virus positive. Just how that's handled, just how it's recommended to be handled is I think, a work in progress. It seems to change literally every couple of days. So we'll take guidance from the health department and any expertise they have, but there might be some sort of final visit with somebody, and then we'll be sure their records go to wherever they came from. And in fact, they could go concurrently. We could keep the primary care doctor or PA or nurse practitioner for these people informed. That's pretty easily done. And we could keep the counseling type people that are in these would be residents or guests in this facility, but they've got some relationships all over the state. So we don't intend to interfere with those. We would more or less plan to, quotes, copy the ongoing care that these people have elsewhere. So that's really our story. We're glad that we're able to help with this, and we know that there'll be a lot of we don't know just what twists and turns it'll take, who's coming, just what they'll have, but I think that just when right, I think that our staff is all spread out. We've got 11 medical providers. Everybody's equipped to do it from home if need be, and so we could end up with a lot of people turning up at once and distributing their visits amongst a number of providers. We're going to have a log here about who's here and all their health checks and so forth. And we'll have across the highway a log of everybody who's here and what their situation is, their medications and so forth, because this will be quite a number of new people in a rather short time frame. A lot of people that we take care of now, we've taken care of for years, and we kind of know them, but we're more than eager to do a good job taking care of these people.
I'm going to ask Sarah, do you have anything to add to that? Just trying to keep track of the time here.
Sorry, I'm just unmuting myself. And also I did, I can add a little bit. And I also, if I invited tonight, Sasha, our Human Services branch chief, who I report to in the State Emergency Operations Center. And so if you would allow, she might be willing to say a few words as well. And so that's Jenny. And so I would offer that she could do that, and then I can certainly supplement.
Okay. Is that your attorney, Jenny? Or
no, not Jenny Samuelson, who's the Deputy Commissioner at Department of Vermont Health Access. Jenny, are you still on the call?
Jenny, you are on. Let's go.
Oh, we might have lost her. Okay, well then I'll just say, really on behalf of the Governor's Office and the State Emergency Operations Center, again, I just want to say thank you to the town of Plainfield and to Goddard College and to the Plainfield Health Center as well, to just recognize that that this is a moment when people need to lean in, and we need everyone to be able to do that. And so I'm really grateful and thankful that to see my own community being willing to do that as well. I want folks to be aware that this is a part of a larger strategy that we have in place to try to create alternative housing for people coming from a variety of settings who cannot return home or who do not have a home to return to when they need to self-isolate or when they have a confirmed case of COVID-19. And so this is not the only place in the state where we're looking to create that capacity. But I'm grateful to the partnership with Goddard College in particular, and to their commitment for wellness and learning and the opportunity to be here at this beautiful facility, and in particular, a site that can meet the needs of families and children who may be in DCF custody as well, and provide that sort of caring environment. So I'm happy to answer questions about some of that larger strategy work, and the work that Paul Dragon and the team has been doing here is really going to help us be able to scale up and meet that need across the state as well.
Well, I think what we'll do right now is we'll go to the select board members to see if they have questions, and then we'll, if people are interested, there is a chat area near the bottom of your screen, and I think I got the instructions properly from Dr. Bull, but maybe he can remind us of if you click on the chat button. You can write a question down, and then we'll be able to read it off so we can use the time most efficiently. But you do have to remember to hit enter after you write your question down so that it will stick. So are there any of the select board members that have questions of any of the folks that have spoken?
I guess the only one that it comes to mind. So do you know how many people were able to serve at Goddard?
Yeah, so this is Paul. The number is approximately 150. Again, it can be a little bit fluid depending on the state of the dorm, but we're thinking anywhere from 120 to about 160 potentially.
Surrounding area.
So the other question that I would have is around the area, the families around that. Is this going to affect them in any way?
The neighbors, you mean?
Yes.
Yeah.
Yes.
Yeah. So, well, what we're going to do again, we're going to post with pink ribbon and signs around the perimeter. We have the signs here. I think we sent them to Sasha. She can send them out, but they're nice signs saying essentially, this is a recovery area for people. So we want to protect people from coming onto the site. And then we will have residential managers and counselors on site and security. So those are the kind of current protections we have in place. We have all the typical things that are already in place, like calling crisis and calling 911 and calling the state trooper.
So Paul, I'm sorry, Jim, do you have any questions?
Yes, I do. Can you hear me?
Yes.
Okay. I guess my biggest concern is what impact this could have on the townspeople and whether COVID-19 could be spread more widely through the town. And what I thought I heard was that people are not going to you're not going to restrict people from going wherever they want to go. And am I accurate about that?
So we are going to educate people per Governor Scott's order, emergency order, and the health department. And these are folks that don't have any other place to go, so they're going to be here, and we're going to educate them about their responsibility not to leave, and we're going to keep interacting with them and trying to make sure that they don't leave. We don't anticipate that people may leave. If they do, again, we're going to do our best to work with the health department, who can potentially have some contact with them, but there is no statewide order to quarantine at this time. And that's essentially what we have now for Goddard is connecting with people deeply. There will be a few people here, for instance, DCF, some departments will come with their populations with restrictions, and those restrictions will stay in place and they can't leave. So for instance, a residential home for the Department of Children and Families, a teenager has some restrictions already in place.
Did you have
Yeah,
further
but they're not
comment?
related to COVID-19. That those are restrictions related to other matters.
So,
Yeah, but there are restrictions related to leaving the property. We would refer to some restrictions. But to your point, to be fully transparent, yes, there is no statewide order, and people can leave if they want to leave.
so
And they could go into town and go to the store in town or go to the restaurant in town, and people would, and the town wouldn't be able to do anything about that.
They are free to leave this site if they do, and we will do everything in our power in terms of education, interacting with them, providing them with really good services so they don't leave. But you are correct, they can leave. There are people in the community, yes.
So I want to follow up with that, Paul, and I know I've already expressed this to you. I understand that there is not any order of quarantine for anyone in the state. I know Janet Ansel has been on the call. I think that is a grievous error, and that educating people is different than saying to them, you are quarantined because you have this virus and you're testing positive. And I would hope that I spoke to Senator Kirchlick this afternoon as well. I would hope that the people in the legislature would ask the Commissioner of Health to make an order of quarantine for everyone, regardless of whether it's terribly enforceable. So people understand this is not, we're asking you to be nice and be responsible, but that you are ordered to maintain quarantine. And if the legislature needs to take up something further, it would create rapidity. I think that really is an important thing to do, whether it's here in Plainfield, which will have a large influx of people that if they were strolling around could be at risk, quite a risk to people. So I'm just reiterating what I've said before.
Yep, thank you, Sasha.
Sasha, could I jump in also? Would that
Sure.
be okay?
Please,
Just
please.
trying to,
Oh, Sarah?
yeah, so yes, this is Sarah, sorry. So I just want to say, you know, if somebody decided they were prepared to leave the site, or they had a need to do that, or they wanted to exit sooner, you know, there would be an opportunity to do that accompanied also. It's not like someone, you know, if they could return to their community and there was a home that they could return to and quarantine home, if that opportunity came about, and the site would be prepared to accompany them and provide transportation and support that. So I just want to name that. Hasn't been named, and I want to make sure that's clear. And then I also want to recognize that, you know, this is the desire and the need for people to stay home when they have symptoms or when they may be positive with COVID-19. I mean, the reality is that could be true for any of us, right? And so we all have we all are able to leave our homes right now, and we all are given the information to stay in place. And we all are given the Vermont Department of Health guidance and education on what to do when we're symptomatic or we're awaiting test results or we have tested positive. The benefit of having Goddard College campus is that it provides also all of the supports needed for people to stay on site and to support the range of needs that people have so that they really can be on site here. And that it is a place where people will want to be and be supported and be able to be here. So I just want to name that piece as well. And I didn't know if John or Dr. Matthews, apologies, wanted to add anything around transmission in particular that would be helpful here to just kind of speak to transmission and COVID-19. So folks had
Sure.
some common information around that.
Well, again, this seems to be changing all the time, but they talk about needing to be within a certain number of feet at 1.3, and now they're talking 6 feet for say 15 minutes. So that I don't want to tell you that that's solid because that might change tomorrow, but you know, it's the case that this is not something that floats too far. We are worried about surfaces. We are worried about hand washing and so forth. But frankly, I realize these people won't want to, you know, have a sign that said I belong in the recovery program. But right now, right in town, somebody could be at the store that's positive and doesn't have a clue. So they're more, you know, assuming people behave responsibly, we're more at risk from the unknown new person than from the person who's you know, been vetted in a certain sense, comes up here, has a staff, because there'll be some staffers. I'm kind of calling them dorm daddies and moms, but somebody's going to be looking out for the people in each structure. The other advantage here, you know, we got these small dorms as opposed to a great big structure. So you could have a dorm that's some mental health people with a mental health knowledgeable staffer. You have some kids that are in foster care. You have some people, I think we'll have some people that aren't positive but have nowhere else to go. Maybe somewhere that they came from was positive.
No.
Sorry?
Wait a second. You are talking about putting 150 people who are COVID positive in one area, in one small town. This is a larger concentration of people than in any of the hot spots that have set off this thing at old age homes and things like that.
I'd like to back up for a second here. We really need to, well, this is a select board meeting. So what we've asked for people to do is put questions on chat, and we're going to hopefully have some time for people to join in. But right at this point, we want to make sure that we hear from as many people as possible. And so people really should not just be joining in without having been recognized. So One of the questions that was asked was the Earth Walk was going to be accessible to the Plainfield community, or is that going to be basically made accessible to the people who are in the program there, and so they're not really accessible to people who live in this area?
Jesus, you're talking about the Earth Walk. This is Paul. I wonder if Dr. Bull would like to talk a little bit about that.
Yes, I can answer that. Earthwalk, for those who aren't aware, is rent space on campus, and they have a number of programs for youth and adults making use of the wooded land in the area. Earthwalk is currently on hold, and so there is no intention for any programming to be going on in Earthwalk throughout the time that this is happening.
So it sounds like that might be an opportunity in the community to come up with a different location so people can continue that kind of activity, and maybe we can be thinking about that. A question from Michael Billingsley asking about that since interactive staff are returning each day to their respective communities, how frequently will they be tested to determine whether they have acquired the virus?
I think it's two different groups. One is the people that stay in the manor, for example. They're not going to have any contact with the positive people. And then Paul would have to speak to the people that come from the state to, I'm going to say, be a dorm mother, dorm father, staff person. I don't think they're going to go home to their families. I think they're going to be living here.
So is there any provision for testing them to assure that they have not also become positive?
So when staff come here, that is the transition zone we talked about. There'll be a facility for them to get out of their car, go into, disrobe, put their street clothes in a bag, put their scrubs on, go to work. Strict guidelines in the dorm. Nothing is foolproof, as I think you're recognizing. Come off site, finish their shift, take a shower, scrub, dispose of their scrubs, go back into their car. Some will be leaving and going home. Some will have the option to stay 24/7 if they choose to live here. As for testing, I will need to defer to the amount of tests that we have access to from the Department of Health.
So if I'm understanding correctly, there isn't currently any plan to regularly test staff to determine what their status is.
Staff will get 2 checks a day for, how they're feeling and telehealth. But Sarah, do you want to weigh in on the testing?
I was just going to say that, Paul, that we'll follow the same kind of protocols that we will for healthcare workers who are also going home from hospitals, right, in terms of monitoring health status and so forth. So it's the same kind of situation for people coming and going from those environments, and we'll follow the same kind of
What is that protocol? Because we have no clue what that is.
Yeah, I don't have it in front of me, Sasha, but I'm happy to share it. We can share that with people.
I understood from talking to Paul that you folks are thinking of putting together a frequently asked questions that we would be able to post. Is that going to happen?
Yeah,
yes,
I think that's a great opportunity for us to try and answer some of these questions, and we can use like an FAQ to do that.
So you've talked a little bit about exit strategy, and this is a recurring question of wanting to know, we're talking about possibly 150 residents for an indefinite period of time. And if they have someplace to go, they're going to go. But how are we going to be assured that we don't have a big influx of folks in our community that have, been homeless, and now people are saying we're done with Goddard, and so they end up on our doorstep? I think that's a recurrent question among folks.
First of all, we don't know the numbers. We are going to try to keep them as low as we possibly can. And again, just to reiterate kind of what we talked about in terms of having the appropriate services on site and interacting them with in a really robust way with holistic health and social services.
And I would just also add that people have communities they're coming from. They may not be able to be home or have a home in those communities, but we will transport people back to their communities and ensure that transition and their reconnection with their social supports in those communities is reestablished. So I think that's a part of the plan as well.
So there's a great deal. Go ahead, Jim.
Yeah, sorry. So these people going to this facility at Goddard are going to be going voluntarily. Is that correct?
Yes.
Right. So when they decide to go there, and you guys decide you want to send them there, and they agree they want to go there, it would seem to me that there could be some sort of agreement that you could put in place that they would not, in fact, go in, leave that facility without your permission, that they're safe to leave, and so that they won't infect other people.
Again, we are going to work with the health department to keep updating our guidance. And back to Sasha's point, there will be full discharge planning, and we're going to start that right at entry, understanding where they come from, where they can go back to, and making sure that they can go back to a safe place in their own community.
Yeah, and I would also say that absolutely, like any housing environment that we have for folks, there are rules and there are expectations and responsibilities and requirements, and that's a part of the intake process, is to outline those and sort of create a shared understanding of those. So that's very much the expectation that will be set, is that people are here to remain on campus. And so, yeah, if that wasn't made clear, I apologize. I think that's the intent.
So I want to.
Well, what was made clear to me was that it's the honor system. You're going to explain everything to them, and you're going to trust them to do the right thing. And what I'm saying is, if people are going to be brought there voluntarily, they could be forced to agree that they're not going to go into town, as long as you folks at the facility, the health professionals, think they are a risk to the general public, that they'll stay there. And are you going to be taking measures like that? That's my question.
May I just, Sasha, is it okay for a technological point of order, just because we're starting to get a little feedback?
I'm sorry, did you hear what I said, my question, or not?
Yeah,
This is Paul. I did hear the question. There is quite a bit of feedback. I think I got the brunt of it. And again, we are going to work with the health department. There is not right now a statewide order of quarantine that would absolutely restrict people. So I'm going to have to go back to our efforts to engage people. They're coming here voluntarily. We will make it a good place for them to stay with wraparound health and social services, and we'll keep engaging them about their responsibility under the emergency order from the governor.
So I want to
So that's what it would take, an emergency order?
No, there is an emergency order right now where the governor is asking people to stay in their homes and to limit travel.
I think what we probably need to do is put a little bit more pressure and our legislative delegation to say, I think there's a broad feeling in the community, whether it's even people at Goddard or elsewhere, there really needs to be something clearer and more stringent. I want to go back again, turning to your attorney, Attorney Wisdom. One of the things that's come up as a question and a concern is that, and I'm just trying to bring the chat up here so I can read this.
Can everyone please mute if you're not talking? There's some horrible audio stuff going on.
Yeah, if people could make sure they're muted, that seems to be something that can happen with Zoom, from what I've been reading myself. So there was a question about whether Goddard was going to be indemnifying the community if something went amiss. My understanding is that the Agency of Human Services has pretty much said to Goddard, we want to reach your campus, and they're taking responsibility. But I also have a question for Attorney Wisdom about whether, does she know whether there could, at this juncture, be an order of quarantine for whether it's people at Goddard or elsewhere in their homes? Is there anything barring that?
Hi, so this is a question for the health department, and we can follow up on that, as I'm not the right person to speak to that question.
Okay. So as an attorney, I would urge you to find out, because this is a really big issue. I have to say, so far, people have really accepted what's happening in the state with the restrictions. But if it happens that there is not clear orders to people, whether they're on Goddard's campus or at their home, that they are quarantined like we would have been when I was young, when the measles came about. And you know, somebody decides to be strolling around and there's a lot of infections, it's going to make a really deep injury to our community, because people are going to feel very much that they were not well regarded. Let's see, I'm just trying to see if there are other questions here.
Can we be recognized by phone if we can't get on the computer, Chair?
I'm sorry, what was the question?
Chair, may we be recognized by phone because I can't get on the computer?
Yes, please. Would you please make it very brief, if you could? Is that Alan?
Yes.
Okay, Alan Goldman.
Yes, it's Alan Goldman. I own the apartment complex next door to Goddard, and of course, it raises many questions. We have shared facilities, shared road, shared sewer, shared water. Is the Pratt Center going to be part of this program? Is the painting building going to be part of this program? That would be my first questions.
The Pratt building
answer this.
is not part of this, nor is the painting. I defer to Dr. Bull to confirm that.
That's correct. The Pratt or painting, that entire portion of the campus is reserved for use for Goddard office space. That's where, when and if the stay-home order is lifted, our staff will continue to return, or where they go to check mail and do work that's not possible to do remotely, like picking up a bill or something like that. So that entire section is completely separate and blocked off from what's being described here.
So there was another broader question about, is the town going to indemnify people in town? Is Goddard, it's my understanding, and maybe I'm not understanding it correctly, is we are in an emergency. This is something the governor says has to happen. Maybe I'm wrong, but I haven't had the feeling that as a town and as a select board, we have much choice, or even necessarily that Goddard has much choice if the state says we're going to use your property. And I don't know whether Leslie Wisdom, the attorney, has any information about that. And are we falsely understanding that we're kind of in a pickle here?
So I think I'm hearing you ask a question about liability. Is that right for the town? So we've had a lot of similar questions from different types of providers, like childcare providers providing services for essential personnel. And we have some responses to frequently asked questions that we can share with you after this call. There is a statute on the topic of immunity from liability, and I'm happy to share that with you as well in times like this, like state of emergency. Can
you tell us now? Well, we have 30 people here that would, I think, are probably, many of them are very concerned about, you know, is the town going to be liable if we don't, and I know the courts are somewhat shut down, if we don't go to court and try to make this stop, or is Goddard going to be held liable? Are they liable because they're renting the place to the state? Do you have any information about that?
So I have to preface this that I cannot give legal advice to the town or anyone outside of my agency, but there is a statute, and I can send you the link to it. It's 20 VSA section 20, and it's on the topic of immunity from civil liability for folks who are responding to times of crisis and states of emergency like we are right now.
Other questions that we haven't gotten to?
Chair, I have another question, please.
Is this Alan again?
Yes, I was muted, but I have another question, please.
If you could be pretty brief, because we do have some other select board business we have to do.
I was brief, Chair, I was brief, and I have a shared group of 52 families.
Alan, I'm talking about going forward. If you could please be brief, because we do have some other.
I'm trying to, Chair, thank you, I will.
Please.
I have 52 families with children right next door. Of course, we're very concerned. The entrance to Northwood is a shared entrance. Are we going to be sharing that with clients of Greatwood that might be walking around? Do I have to worry about children? Do I have to worry about divisions? This is a complex issue for us. Please help us.
I have not heard whether or not the infrastructure, I've posed the question now twice about whether or not the infrastructure is up to code for supporting.
I didn't say that, Chair. I'm talking about the roads coming into the complex.
Alan, somebody else is asking a question. If you could just listen, thank you for expressing your concerns. And if we could go on to the next person.
Could I please have an answer about the road?
Again,
I think I can answer that, Paul, if
Go
you
ahead.
want to clarify. But the intent is for that road, the road that would go to the to Pratt, and the shared access would not be used for this purpose. This would be separate, would not be used for the purposes described here today.
That's correct.
Thank you, Dr. Bull. Could we please, as the road continues down towards the Oak Clay Hill, can we please keep that open and use the lower path if they need access to the Clay Hill, please?
Rick, you're not on mute.
Can you talk with him about and Paul about that separately?
Yes,
I think
absolutely. Yeah, it seems like a reasonable request, and we can follow up
Well,
on that.
then I just have one last question, and I'll be done. What do I do about the shared water experience? Do we have to worry about corona contamination through the water coming to Northwood?
No.
So
I don't think that there's any concern.
that's right. There's no reason to be concerned about the water.
Okay, thank you.
Right.
Okay, so could you identify yourself on 229-1236?
I have no idea if that's me or not.
I think it is.
Okay, this is Rhea Wilson.
Oh, hi, Rhea.
And I'm trying to find out what I've been writing messages is that we're talking about 150 people coming to one small place in one small town, and that is a greater concentration of COVID positive people than in any of the hot spots around the country, the cruise ships and the old age homes and things where there's been a problem. Why are we talking about such a huge influx in one little place? And how can we get it down to some regular kind of size?
This is Paul. That was one of the estimates of the capacity based on dorm beds. We can work on limiting that. Again, we don't know the numbers that are coming, but we can certainly work on limiting the census here.
I think
So, and
This is
Paul-
Deputy Commissioner Samuelson. Are you able to hear me now? I've been trying to get my audio on for the entire conversation. It is, well, Paul did speak earlier that the capacity of the Goddard site is 150. It is our intention to not go above 100. In addition to that, one of the things that we haven't spoken about is the fact that there will be on-site security during the entire time that we're there. And that on-site security will ensure that individuals are not leaving campus. And if they choose to leave campus because it is voluntary, they will be accompanied until we are able to respond. And so I want to be really, really clear. In addition, as Dr. Matthews said earlier, the best way to prevent the passing of COVID is through social distancing. And as of right now, there is no evidence that coming in distant contact with someone could actually transmit it from person. So that social distancing of 6 feet away is the current policy. So our goal is not to go above 100. And in addition, we would not have 100. This is not for the general population. We would not have 100 cases there. We would not have a significant.
Who is speaking right now?
This is Deputy Commissioner Jenny Samuelson.
Okay, great, thanks.
Health?
And the Deputy Commissioner of the Department of Vermont Health Access.
And why were we never consulted about this?
Could we also address the infrastructure question in terms of whether or not Goddard is up to capacity in plumbing, in electrical, in wastewater management? When was the last time they had 100 students or in residents on campus? When was the last time that those buildings were used? Are they up to taking the load?
The last time would have been about 6 weeks ago. We had our largest. We have a number of residencies each semester. Our largest residency ranges between 100 and 150. The dorms and the spaces that are being used for these purposes are the dorms that are regularly used as dorms for students or faculty, or for the Governors Institute as a renter.
What's the length of those residencies? Does it exceed 6 weeks?
The residencies typically last 10 days. I'm the only permanent resident on campus. I live in the cottage for the last 15 months.
Okay,
think-
so
I think
beyond 10 days, what is the septic system going to do with 100 people? What's the electrical system going to do with 100 people using it? Like, have things been updated and maintained to be able to, and are they sterilizable? Like, can this place be cleaned effectively and efficiently?
I think the cleaning issue is something that these are all people, they're talking about everybody being positive. So they're going to be together. They probably can play Scrabble easier than some other people can. And in terms of the cleaning, that would come at the closure of the use of the facility. And I think we should be having some understanding about how that will be done and who will be doing that. But I think in terms of the buildings itself, the sewer system may be a good question, but it's really, it would
What
seem
about the electrical? What about, like, I mean, there's a number of things in on the campus that I can see visually driving by that, like, are questionable whether or not it's going to be able to support that number of folks with the intensity of needs that's onslaughted for us for a sustained period of time.
Yeah,
Some of the
I can only speak
CDC
to-
recommendations are that folks are still shedding viruses post 3 weeks after, like, being asymptomatic.
I can speak to just the current usage of the campus. Right now, we've actually shrinking the length of residencies, but it is a 3 to 4 month period twice a year in which we have regular residents who are coming and going.
At a number of 100 plus people?
It can range. It can range anywhere from the close to the high end of 150 all the way down to 30 to 50 at a time.
So there are some other questions that were asked that I want to get to. George Cushing was asking, how did this all come about? Was there a meeting? Did the select board have some role in this? Paul can answer this as well. And I can say the first I heard of it was perhaps a week ago when Sarah called me to say that they were tentatively thinking of this. It didn't appear to me that we were being given a choice, and that so the reason we wanted to have this select board meeting was to give as much information as we could from the people in the know, because of course this is of great concern to a very large number of people. At the same time, the sands are shifting under all of our feet in a way that we didn't ever anticipate. So, Paul, do you have anything to add to that in terms of how did this all come about and why are we here having a conversation about this?
I'll defer.
Maybe I can.
Yep. Go ahead,
Yeah,
Sarah.
maybe I can jump in, I think,
Yeah.
and Jenny, feel free to jump in as well. These are conversations that we are having with towns and cities across the whole state to be able to create the needed capacities that, frankly, we all need to be able to help people to adequately isolate and self-quarantine, to be able to reduce the spread and to be able to manage the impact on our healthcare system. So Plainfield is not the only town where we are having these conversations. And I'm actually really grateful to be able for the leadership of the select board to pull this meeting together with Dr. Bull and all of us so that we can try and answer these questions. It was just a week ago that we reached out to Sasha to say, we're going to have a site visit at Goddard College. It was literally within 12 hours of me reaching out to Dr. Bull saying, what are the opportunities for us to be on this site? But I also want to let you know that this is not the only town where we're having these conversations. This is not the only need that we're trying to fill. And so we're not choosing this town and for any particular reason other than there's a site here that works, there's a willing partner, and there's and the ability to serve people well on this campus with enough services and support and security to really meet the need is something that we're committed to doing. So,
may I speak?
And who is this?
This is Rick Levy.
Yes, please do, Rick.
Okay. I've listened to all of the conversations since we started, and it sounds to me and seems to me that this was not well thought out prior to its being introduced to the Board of Select persons, that there are lots of unanswered questions still, that the idea that Goddard is, how much is Goddard making out of this deal while the campus is empty because there's nobody enrolled? And the idea that it's voluntary, but there'll be security, but security can't follow everybody. If a group of patients wants to leave, and I can see, since they're going to be coming from all over the state, they may want to leave early to go visit their friends and family, for instance. Security is going to follow them, or someone's going to call the state police, average response time being like 45 minutes or an hour. As an ex-constable, I can testify to that. The Lamoille County Sheriff, instead of Washington County, is going to do this. There are lots of things here that were never answered. And my biggest complaint about it all is this is supposed to be a democracy. The idea that the state can order Goddard, a private institution, to harbor or sequester people, I don't follow. And the idea that the neighbors and the town was not consulted in general before these decisions were made doesn't strike me as being particularly democratic.
Where is the documentation specifically that mandates that the government that has mandated Goddard as a designated spot?
There's no mandate. There's no mandate that Goddard is a site.
So is this entirely voluntary? Did Goddard step up to the plate and say, hey, we got a spot?
So I can share about that from my perspective, and then if the state would like to represent their perspective. I believe I may get my days off by a few, but just to give you a little sense of the timeline, would have been about 12 or 13 days ago that I think we had first outreach, and Sarah had reached out to the college noting that they were looking for a site, and the scope, it was still being clarified, I believe, at that point, but a site for purposes and potential use of one of the dorms. And we were one of the sites they were looking at. And I'd been informed by colleagues elsewhere there might have been other places they were looking as well at that point. So we just waited to see where things might go. And it would have been, I think, 9 days ago. So it would have been last Saturday that I got an email asking to have a follow-up meeting with Paul Dragon. And Sunday, Paul and I met. So that would have been 8 days ago or so, and indicated that he'd made a visit to Goddard and taken a look at it. And it seemed like optimal location given some of the criteria that they had set. And please correct me, Paul and Sarah, if I'm representing this inaccurately. Further describing sort of the goals and the purposes. So I believe that's Sunday. There's a lot still being organized, I believe, on the state level at that point too. It's pretty amazing the level of organization right now compared to even a week ago, just how quickly different groups came together to try to make this happen. So I believe it would have been that Monday or Tuesday that we had, I asked for a meeting with the different stakeholders with the state to come so they could better understand sort of the needs and the interests. By the way, the demand and the time sensitivity was clearly articulated from the state from the beginning, that whenever I asked, well, when would you like to do that? That was the days ago. I think the response was, well, today if possible. I mean, there was a real sense of urgency. So I believe it was that Monday, and then that I believe that same day I left a voicemail with Sasha, and then sent a follow-up email, I believe, on Tuesday. I can't remember when we talked the first time, Sasha. It was within a couple of days, though. I understand that also at the same time that Paul and the state and Sarah had already reached out to the select board and had begun conversations and explored things from there. That's kind of what's led to where we are today. So things have moved very, very quickly.
I should probably clarify that The other two select board members were only informed about this a couple of days ago, and that was in large part because plans were tentative, and the Agency of Human Services had said that they were going to put out a statement, and they were hoping to get a bit firmer in terms of what their plans were. So the other two select board members have not been so much in the loop, and I don't want that to be not that I've been terribly in the loop either, because people have been moving very fast in terms of plans. So
I will say.
So I was just going to add, sorry if I may, Dr. Bull, sorry. I was just going to add that I do want people, although we're moving rapidly and quickly, I want people to feel confident in knowing that we're working very much with partners from Department of Aging and Independent Living, Department of Children and Families, from the Vermont Department of Health, and we're following CDC guidance around alternate care sites. So this is a well-informed project. There's some substantial amount of lift on the part of Paul and his team and folks from across the whole agency. So although there's only a handful of us here on this call, I want people to feel confident in knowing the amount of effort that's going into standing up this site in a really well-designed, well-organized manner. And like Paul said, I think we're glad to share policies and procedures and to be transparent about those with people as well.
So there is also a question.
Wait, could I just jump in?
Yeah, this is Jim Bowles, if I could jump in.
Yes, please.
I just wanted to say that I want to clarify that the select board in Plainfield doesn't actually have a decision to make, right? This is just for public information, why we're having this call right now and to bring us up to speed. But if we were all the select board were to say, we don't want this, we don't really have a say in this, right?
That's an actual question.
It is a question. Leslie
Right.
Wisdom, the attorney, do you have any information for us?
I thought the question was to the select board.
I'm on the select board, and I'm asking the people from Goddard or from the state. Does the select board have a say in this? And my takeaway is that we don't.
I don't. It wouldn't be. I'm not under the impression that the select board does need to approve or vote on this.
Right. That's what I thought. Thanks.
So it sounds as though what you think is that we could make a decision that we don't support it and make that clear, and that would be something within the options that we have. Because I think that this does need to get clarified. We have a select board meeting. Maybe who knows what will get brought up. I want to reiterate, however, I think that everybody who has some role in the government needs to be demanding that there be orders of quarantine for everyone who's at Goddard and people who are not at Goddard, so that people are really understanding this is not, we're asking you to be nice. And that needs to happen. If Janet Ansel has any pressure to bear, that would be helpful. But I think the other employees need to understand this is not a HIPAA issue now, where we have HIPAA confidentiality. We have what everybody is telling us is a public health crisis. And people need to be saying, this is one small step we could take, as it may not have the effect that we like, but to just kind of throw up our hands and have people have some authority to be going, well, maybe we'll think about it. It's, I think, very troubling to a great many people that doesn't seem to be on anybody's platter to take some active effort to make that happen.
Excuse me.
Yeah, and this is Jim Bowles. I agree with that.
So do I. And first,
and could you identify yourself, please?
The one set of people who were not consulted in this are the people of Plainfield. And this is really an undemocratic process being foisted upon the village by state authorities who never came down and talked to anybody in Plainfield either.
So we have a question from Rhea Wilson asking, why was no one in the surrounding neighborhood consulted as all this was being put together? And also she wanted to know, how would we know if all this new monitoring and counseling will actually work? So she had two questions there. And I know that she is not alone. I got a call from another individual who lives very close by to the Goddard campus, and she also had similar concerns. There was also a concern from somebody posted on Facebook about, wait a minute, that's where my daughter walks. coming home, although I'm not sure if coming home from where. So I think there is a broad concern in the community that there wasn't a consultation, and perhaps there could be an explanation of why that didn't happen and why people are who are proposing this think that that's an acceptable approach.
I think we're here today listening and answering questions. I think that is what we're doing in an effort of transparency and partnership and cooperation. I think that is what this is. I think, there's ongoing communication with individual neighbors who have reached out to speak directly with Paul. I know he's been engaged in those conversations and to be responsive to the needs of neighboring property owners and their concerns. I think our intent is to be as proactive as possible in our communication with folks and continue to welcome feedback on how we can do that better through an FAQ or through other additional forums. I think we're open to doing that and wanting to do that as well as we can.
What would be better is to have 10 people or 20 people in each community who are together and not 100 or 150 in one place.
And
that would be better.
Here, here.
Please identify yourself. Who wants to just spoke?
Please, one other thing, please. I am a neighbor of Goddard. We have a small group of folks around here who are all neighbors of Goddard, immediate neighbors. None of us were ever consulted by anyone.
Thank you.
This is Tammy Farnham, and I would, I guess I would, like to say that we all have to recognize what we're in. It's not something that we obviously stopped and planned for. And I think the state is truly trying their best to try to minimize, to try to recognize how we can help the most people we can. And so as much as it's scary for our community as a whole to bring these people here, we also need to recognize and stop and understand what the state is trying to do. It seems like having these people in one place that they can get the help they need and organize that in a manner that hopefully they'll stay, that actually protects our community more so than to have them wander around and have no place to go. So we have to, truly, I understand this, that how scary this is for all of us, and this is our community, and I get that, but we don't have time. You can see the numbers growing greatly. And so my hat goes off to the state to do what they're doing and participate and try to bring things together that we never stopped to plan, even a month ago. So I do hear what everybody's saying, but I also hope that we can all recognize this is really the safety of our entire community as a larger piece, not just Plainfield. So that's what I had to say, that, listening to what they're trying to do and listening, and I think the open communication is the biggest thing. So hearing, obviously, I'm concerned with the neighbors just as well, and I want to make sure that those people are protected and that we do those borders and boundaries. I will echo what Jim was saying earlier in reference to if people are coming voluntarily, that they need to sign some type of agreement that states that they stay on the premises. If they choose to leave the premises, then truly they need to go back to their community or be told, because they don't need to be in our community. And that's definitely, I would back Jim on, I agree with Jim. If they don't want to be there, then we just need to take them back to their community. And I don't know if at that point, and that's back what Sasha was saying, at that point, if you're going into the community and putting the community at danger after you've been pertained, what's the restrictions the state is going to put on that? So I guess so I do want to thank the state, because I think the state is everybody's ideas, and what they're trying to gain is huge. And thank you for that, because I think overall, I hope Vermont can stay safe.
And so I want to take as the last comment, Amos had wanted to offer a comment, and then we're going to go, unless the other select board members disagree, we're going to go to the other items on the agenda.
Actually,
we are about half an hour past.
Chair, may I please have one more question before you end? I am the only person that has a woven campus with God, and it's very complex.
Excuse me, I recognize someone else. Amos has the floor right now, so let's please.
Yes, I'm asking, Chair, may I please have one question before you end, please?
This is really important that we do this in an orderly fashion. This is a select board meeting. Go ahead, Amos.
I realize, Chair, I'm just asking afterwards, may I please have one question?
You are going to have to be quiet now because you are not recognized, okay? Go ahead, Amos.
Thank you, Chair.
Thanks. So I definitely, it's complicated, and you know, some of my fears of some what other people have expressed are definitely there in terms of potential risk of people leaving the campus. I'm not, you know, I'm not worried about it from a COVID issue, you know, transmission issue. I mean, I think as we all know, someone, you know, leaving doesn't mean I'm going to come into contact with them, and most likely they're going to be headed back home. I think the biggest thing, I know, you know, there's so many issues here. I think one thing that would be helpful is to kind of have something written out a little bit in terms of the rationale of why this kind of campus is needed. And I know that things had to come together very quickly, so you kind of develop some of the documents afterwards because you're working on the logistics and kind of getting things into place. And you want the documentation and the explanations to really be thorough and not you know, be in any way kind of leading down other paths. The fact of the matter from my perspective, and I thought, Tammy, I really appreciated your comments. I thought they were spot on in terms of the fact that we're talking about the larger Vermont community here. And you know, whatever barrier you want to, you know, lines you want to put up around different communities and different borders and whatever. It's, you know, if people, there's a need for people to be to get the help that they need, and places that people are going to be coming from to Goddard, they can't get that level of help that they need there, which means that they're more at risk in the place that they're at to then potentially spread the virus. So this is really, you know, from my perspective, and I think that, you know, I'm sure there'll be more information coming out about it. It's a public health issue, and I think it's the right thing to do. I think it will be interesting to know. It would be great to hear that that the more sites are developing around the state, so we can kind of minimize the density. That's really a lot of what this overall illness is about, is limiting density. But I think that, you know, it's very manageable. When you think about hospitals and density in other places, you know, I don't know about people's comment that this is going to be the most dense in the country. I have a hard time believing that. You know, so you know, I think that, you know, it's got to happen somewhere, and you know, there are a lot. I think that the concerns need to be heard, and I really appreciate people, you know, the select board putting this together in the state. And, you know, I think the communication can continue, and the concerns be heard and addressed as they're able. It's a tough format for it, but you know, I think it was actually not a halfway bad job of getting some of it out. But I just want to say that, like, and this is a little bit maybe abrasive to say something like this, but I think that this, you know, this type of thing needs to happen somewhere. And, you know, if the concerns are addressed, anything else that says that it shouldn't happen here, where's it going to happen?
And I just want to follow up as well and point out, if people may have forgotten this, because it was way early in the meeting, that Paul Dragon did say that he would be willing to get together with the community again, and perhaps what we can be thinking about with the select board is having a more regular time where we're hearing from folks from the state to just kind of give us an update in person, if that's something that would resonate with other people. I know that there was a caller who wanted to have something else to say. It was already spoken twice, and unless the select board disagrees, I think what we would do is conclude this part of the meeting.
Sasha, I would like the floor for just a brief moment, if possible.
Please.
This is Balin Sloat, Town Health Officer.
Yep, thank you.
Yeah, and I want to thank you for having this meeting. It seems like a very difficult thing to administer over Zoom, and I think you've done a good, laudable job. And I want to thank everybody's comments, as well as everyone laying this out, what seems like very actually well thought out from the state perspective in such abbreviated timelines. And I just want to add one piece, which is to call our attention to the idea of mandatory quarantine. And I personally, from a personal perspective, have some concerns about what you just asked as far as us as town and state officials of advocating for that. I understand the concern at this time for potential exposure to townspeople. However, I think it's very tricky for us to ask for a thing like mandatory quarantine because that's essentially locking people up. So I'm concerned about that, that I think that the concerns that have been raised have actually been thought out in very, very thoughtful ways by a lot of the people we've heard from on the call here. It also sounds like they're moving targets. And like, for example, what Jenny Samuelson had mentioned about having escort or security people, and really, as well as Paul described, having a lot of education to people in residence at Goddard. From my perspective as a town health officer and from what I know about this disease, it seems to me that that is very reasonable measures to mitigate risk of increased exposure. It sounds to me like what Dr. Bull has described as being separate facilities allowing for individuals to be quarantined in small dorms in a setting that has a lot of nature around it could really be a thoughtful way for us, as Amos has described, to make a meaningful contribution to what needs to happen in this virus at this time. I think it's important that we as townspeople continue to be involved in the discussion, but it sounds to me like it's also very important that we join into the group effort here of what's going on. And I just wanted to raise a little objection about this idea of mandatory quarantining, because it sounds good until you get tested in a certain way and then you end up locked up away from your family, unable to leave with police escort. And that's a very scary possibility that I think we need to think some of these things through a little farther. Thank you for allowing me some space on the floor. And again, thank you to everybody on the call.
Well, thank you so much, Balin. And one of the other things I wanted to remind people of, and it was something that I was particularly impressed with as well, when Paul was talking with me a couple of days ago, one of the things he mentioned, and he mentioned it tonight as well, is approaching this from an awareness that many of the people who may end up on the Goddard campus have come from some circumstance of trauma. And certainly for people in our community, what's been going on for many people feels traumatic as well. I have been a foster mom. I've worked for social services as an attorney. And I think to have that insight that we should be, that they, in working with this population, will be looking at not just what's the physical health, but also what's the psychological and mental health, with the hope that perhaps people who are in this circumstance will be healed in ways that are not just physical health. I just think is very, very thoughtful planning. And I was very impressed with that as well.
Tasha, can I just say, this is Paul, can I say one thing?
Yes, sir. And then we'll be done with you.
I just want to say that the town and the residents will be a priority going forward. That we can do regular meetings per your schedule, regular contacts. Sasha, you have my phone number, my business cell. I am very happy to give that out. I encourage people to call. I will answer questions. If I don't know the answers, I will consult other people. I do want to say this is a pandemic. Things happen very, very quickly. The state of Vermont has a responsibility for the most vulnerable people in this state, including people who are homeless, including kids in foster care, including kids in DCF custody. We had to take action quickly. We're doing it around the state. I apologize for lack of communication in the beginning. I'm hearing strongly, and I take it into my heart that we are going to be prioritizing your concerns and challenges. And just from my perspective, this was an extremely helpful meeting, and we would love to keep working with you going forward.
Okay,
Chair, may I please be recognized one more time for a minute?
No, I'm sorry. We've had some people speak more than once, and we really need to move on to other matters.
Chair, I was allowed a very short time. I have a very quick question, Chair, please.
That is really not an option at this time. We really
Chair,
need to be
may I please be recognized while I have Dr. Bull and Paul there? It's a very pertinent question.
I'm sorry. We really must move on to other matters. And
Chair, I need 30 seconds, please.
No, I'm sorry. you are not in order at this time. We are moving on to other matters, and you have a way to get a hold of Dr. Bull, and we can get you Paul Dragon's phone number as well. But at this point, we're going to move on the agenda. So,
Chair, I just have 30.
sorry, it's really important to understand this is a select board meeting. This is not just people getting to interrupt the flow of what's happening now. And
I'm not interrupting, Chair.
Excuse me, you are interrupting when you are not listening to the fact that we are moving on to other matters. I appreciate your 2 times that you spoke, and right now that's it. So I want to just consult with the rest of the select board. We do have a couple of other things on the agenda, and whether they want to continue.
Chair, the question already would have.
Sorry.
Just curious.
You really need to stop, Alan. You have ways to get a hold of people. This meeting is not the place to do it. So Tammy and Jim.
I'm not doing that, Chair.
I
Muted over and over.
Alan, you are out of order. You need to please be quiet and let us continue on with other matters. So Tammy and Jim, what's your pleasure about taking up the other matters on the agenda? Tammy, Jim?
When we share trails.
Tammy and Jim, I'm looking to hear.
Can you hear me?
Yeah, go ahead, Jim.
Yeah, I had my call got dropped a couple of minutes ago. I just rejoined, so I'm fine going with whatever you want to do next.
Okay, Tammy, could you stay on for a few minutes longer?
Yep, that's fine.
Okay, so the next item.
I'm not going to be allowed to have a minute, Chair.
No, you are. I'm sorry, Alan. We are moving on to other matters. You have ways to get a hold of other people, and this is not the place. This is a meeting that has moved on to other matters.
Alan, you're welcome to call me on my cell. Alan, you're welcome to call me on my cell. We talked earlier today. Please call me. This is Paul. I appreciated our earlier conversation. You can do it again.
So moving on to the next item on the agenda, we had 2 issues. One was the approval of a letter for the 2020 Economic and Infrastructure Development Grant.
I have begged to understand about people walking around in a shared campus.
Alan,
I have begged.
You are out of order.
I have begged to please somebody help me. How do we manage a shared campus?
Alan.
Put Mr. Dragon, call.
Address this, please.
I mean, Alan, call Mr. Dragon. He offered that.
May I call him now?
No, you can call him. You can call him on his phone. You have his number. Call him when you're ready.
I said that. Fine. But I'm also asking Dr. Bull, how can he help us because we have shared trails? I don't know what to do.
You are
talked about this already.
At this point. Alan, really, you are out of order. You need to deal with.
Actually, Chair, you've been quite rude to me the whole time, and I've recorded it. I have been muted more than 35 times by somebody in your office, in your presence there. And
Alan?
Maybe we can mute you again.
You're still out of order.
Can somebody mute him, please?
I've been trying. In fact, maybe Dr. Bull, you could put a permanent mute on that because we really need to move on to other matters. So, so there's the approval of the letter of intent for the 2020 Economic and Infrastructure Development Grant. I had thought that today was the 31st.
You've made a mockery of this process. A mockery.
President Bull, could you possibly mute that this number is 229-1236 permanently? Is that possible?
He's not on the call anymore, probably.
Okay. So this, as I mentioned,
I move the approval of your letter of intent.
You've muted me like 30 times. I'll be bringing it up to the.
Okay. So this is a letter, and it's merely a letter of interest. It doesn't say that we are necessarily going to apply for any funds, but it kind of puts our hat in the ring. And I would propose, since we aren't getting together in person, if other members of the board don't mind, I'll redo the letter and just have me sign it on behalf of the board. If that's your pleasure, whatever your pleasure is in that regard.
Yeah, I'm fine with the letter. You're not talking, when you say redo it, you don't mean redo the body of it. You just mean redo the signature line.
Right. Just have one signature if that's okay with you.
Yeah, I'm fine with that if Tammy is.
So
this is just an intent, so it doesn't mean that because we haven't really looked at what the grant is or what that means. So
It's
this,
actually
It's not even an intent.
less than that. It's actually a letter of interest. And
Okay.
we have until the end of June to actually make an application. And I think we can sort through, there may be a number of different possible infrastructures issues in our town that could be of use, but it's not even saying we're necessarily going to apply for the grant. It's just saying we're thinking of
We're
throwing our
interested.
hat in the ring.
okay, yep. I'm
So
fine with
all in
that.
favor of me sending the letter that was just basically stating our interest? If we could say aye, and just, we do need to do a roll call. So Jim?
Yeah, I say aye.
And Tammy?
Aye.
And I will also say aye. So that takes care of that. The other item was I had circulated a preliminary policy for boards, committees, and commission meetings using web-based programs. My concern is, and I can tell you, I tried to set up a new computer today, and I'm using another little computer that Ed got from someone else. It was very time-consuming to try to figure out how Zoom worked. Whether Zoom is the best program or not, I don't know, but I do think in terms of not burdening people in town with having to learn different programs for each committee, that from my perspective, I would like, and obviously I'm just one vote, I would like to see the select board make a decision as to what program would be used for the town and have it be clear to the people who are, who would be running the meetings, that what the nature of the meetings are. So, and I also, as far as I know, there really is no committee that has any kind of urgent, dire need to have a meeting that we couldn't take a little bit of time to do this. But it's, you know, the ball's in your court, Jim and Tammy.
Well, I tried to log into Zoom on my iPad, and I wasn't able to. The only way I was able to participate in this meeting was with the phone. I wasn't very impressed with Zoom. Do we have to make a decision today about this?
No, what I would like us to do is to approve, if you're comfortable with it, approving the preliminary policy, which says that the select board will make a decision about what program to use. And since we haven't made a decision, the committees and boards and so on would not be meeting using this kind of modality until we can do a bit more homework.
Well, what about if we say that people can meet electronically in any format that they find agreeable, as long as there's an opportunity for public members to log in too?
What's your thoughts, Tammy?
I'm going to agree with Sasha. I think that we need to be fair to the community. We need to figure out one resource that we're going to use as a town so that you're not having to learn different programs, that you can utilize one. So, I mean, we're willing to hear any committee members' suggestions in reference to which program to use, because I don't think we have a preference at this point, but I do think as a town, we need to use one.
May I ask?
Yeah, but are we picking it tonight?
No.
No.
Or can we pick it at some future meeting?
Michael here. May I ask a question, please?
No, not at the moment, Michael. The board is having a discussion and we are not taking public comment at this moment. So Tammy and Jim, my proposal, and I sent this out to you, is that it's a preliminary policy which says that the board should decide what the modality would be, that there should be some training. I think there needs to be training. These meetings are a little trickier. I think sometimes it's easier for us to deal with people in person, sometimes not, but that there needs to be training in terms of what the requirements are of the law and how we address each other, and how people are, one thing I heard, I saw come across the Plainfield People feed was a thought, well, if somebody doesn't identify themselves, they get disconnected. And from my own perspective, people can always come to meetings and don't have to identify themselves. It's a little thing, but I think we really need to be thinking about what would be the training that would be part of whoever gets designated to be able to conduct those kind of meetings. And so that's what I put in this preliminary policy. We can always revisit it, and probably will revisit it and change it. But I would like to see us give ourselves that kind of breathing room if other people are comfortable with that.
So you're asking us to adopt the policy that you drafted, that you sent around? Is that what we're talking about?
That's what I'm hoping I could persuade 2 people to do, or maybe 3. But again,
Well,
I
just wanted to understand what you were saying.
And your thoughts, Tammy? Oh, sorry, go ahead, Jim.
No, Tammy, whatever Tammy thinks.
I'm fine. I mean, I think that that's the direction that we need to take, and then, you know, we can always make changes for that. But I think it's a good start.
I have a question for clarification, and it is in front of.
I'm sorry, Michael. Michael, you're not recognized. The board this is not a time for public comment at the moment. Is there any more?
Clarification, and please, I've written it to you as well, so you could read it if you wish.
I understand that, Michael.
Who is Michael?
Michael.
Who is this?
This is Michael speaking. I had a one-word.
Michael who?
Michael Billingsley, sorry.
Okay, go ahead. I mean, if Tammy lets you.
Question is, if our committee is able to provide live video and sound plus a telephone connection for anyone who wants to participate via telephone, does the select board forbid us from holding a legal meeting?
Okay, what this policy would say is that the select board is going to decide what the medium would be, and that it would be consistent across all boards and committees. So we wouldn't be asking people to have to learn multiple ways of connecting this way, that the meetings will be done in accord with the law, that there will be people designated who, for each committee, doesn't even necessarily have to be a member of the committee, but they would be clearly designated, and that they would go through some training before there would be a meeting of this nature. So at this juncture, since that hasn't happened, the outcome would be that there would not be meetings using electronic capabilities until that homework had happened. So Tammy, did you have something else you wanted to say?
I guess what I want is consistency, so that we're managing every meeting. If we're doing it this way, that we're managing every meeting same. It doesn't matter what committee is taking place, but everybody, any community member should log on and be able to know what's going on and how it's working versus fumbling through that. If we're supposed to be open to the community, I think it's very important to be, I guess, it's the same. So that's my feeling.
Tammy, did you see the policy the preliminary policy that Sasha sent around? Did you read that?
I did, yes.
Okay, so did I, and I'm fine with that policy as a preliminary policy. So why don't we put it in place today, and then we can always, it's preliminary, so we could always revise it at a future date if we learn from folks that there's a problem with it.
I agree.
Is that a motion? That
Yes,
the board approve the preliminary, so the title of the policy, and we'll post this shortly, is Preliminary Policy for Boards, Committee, and Commission Meetings Using Web-Based Programs.
Right.
I
move we approve that.
Is there any further discussion?
Too long. No.
Tammy, did you have any further discussion?
No.
So all in favor say aye, and when we go by roll call, Tammy?
Aye.
Jim?
Aye.
And I'll also say aye, so that takes care of that. The last thing on the agenda really was having another meeting. Our normal meeting would be April 13th, which I'm pretty sure we aren't going to want to do in person. And I thought we should, we also had approval of warrants, and I don't have actually approval of warrants and of minutes. There is a list of minutes that we haven't approved that I think people have looked at, which is January 27th, February 19th, the 24th, the 27th, March 9th, March 13th, and March 17th. Does anybody have any thoughts about whether we should go ahead and approve those minutes at this time?
Yeah, I move we approve all those minutes.
Any further discussion?
No.
Okay, hearing none. Tammy, what's your vote on that motion?
Aye.
And Jim?
Aye.
And I will also agree with that. I don't have in front of me any warrants, so I think we may need to put off the formal approval of warrants at this point.
Okay.
So relating to the next select board meeting, the things that came to my mind when it's not an exclusive list were obviously coming up with a date, addressing appointments. There are quite a number to be made. We would normally have made them either the first or second meeting in March, when we didn't have the second meeting, to look again at the preliminary policy for boards, committees, and commission meeting for meetings using web-based programs, and also just doing an update on the AOT programs. I know I've heard from a number of people that they were very concerned that us not having a select board meeting was somehow going to put in jeopardy going ahead on AOT programs. And I don't know whether, is there anything else of urgency that you folks feel that we need to put on the agenda? I mean, should we be putting on an update from Goddard, depending on how quickly that happens?
I mean, I was actually going to recommend, and even if we do a short select board meeting, I think that because this the virus is spreading and there's so many changes so daily, I actually would recommend that we set up a select board meeting for the 6th to do just an update with Goddard to see where we're at and to make sure that everybody's concerns are being met. And we're having clear conversations if that works with everybody. I just want maybe some consistent appointments, maybe every Monday. We just set, even a half an hour or 40 minutes aside just for that piece would be my recommendation.
Okay.
Well, we have our regular scheduled meeting is April 13th. We have the ability to have a special meeting if we need to. Why don't we have a special meeting if somebody thinks we need to? I mean, so Tammy, you're saying we should schedule a regular meeting on the 6th?
No, I want a regular meet, or we can just do a special meeting. Just, I want a half an hour, 40 minutes for people to make sure, and maybe it doesn't even need to be that long. I just want to make sure, because this is moving so quickly, I want a time where the neighbors of Goddard can express and know that they have a time to check in. Anybody in the community has a time to check in if they have concerns or see something. I want to be proactive on that. I know this is scary and I know that people have concerns, and I just want a time. I feel like we should set a time that says, okay, every Monday we're going to do a check-in. And again, that might be a 15-minute thing, but I think we need to schedule that accordingly.
So are you proposing, Tammy, that as to the other items like appointments and
Well, we
getting
can
an...
do that on the 13th, but I'm just...
Okay. Okay.
I'm saying that can be done on the 13th. I just want a meeting for the Goddard check-in.
Okay.
So you want to have a meeting on April 6th at 7, which we would do electronically again?
Right.
Well, that's the only way we can do it, really.
Right.
So
and then on the 13th, so for a regular board meeting, we would then start it with a Goddard check-in, and then we can go about our normal meeting. But I think that we need to do that on a weekly basis to check in. And again, it might be 15 minutes, and maybe we do it as a special meeting and the select board meeting to follow, something to that effect. But I think that it's happening so quickly that we need to make sure we're staying on top of it.
Well, when you say check-in, you mean hearing from who?
From the state, from the community, to make sure that there's no concerns that are being overlooked.
would that work for you, Jim?
Yeah, do we know when, I don't have a problem with that. Do we know when this Goddard thing is going to start?
We have not
When are they going to start sending people in?
We have not been given a precise date on that. And I think that's also a moving target. So,
so April 6th might be too soon.
Well, I think there could be things that come up that we could still want to hear about, that even if people have not moved in. Is that your thought, Tim?
I mean,
I do.
I'm fine with us scheduling something for April 6th, and maybe there's something to talk about, maybe there isn't. That's fine. Let's just reserve the time for that, sure.
So that everybody knows when there's a time available to express concerns or whatever that may be at that moment.
Okay, so that would be the 6th at 7 p.m. And of course, one of the things we can also do, and if anybody from the community has insight, the other meetings that I've heard, the programs I've heard are, I guess, a GoToMeeting, and Linda sent us another one recently, and other people have, when we had the select board meeting at the Agency of Transportation office on the 13th of March, that used Skype. I think we might want to consider using some of these meetings as an opportunity to try out other programs, or if people in their real lives have opportunities for that, or anybody in the community wants us to give us information of that, please, email me and I'll send it on to the other select board members, because I think we really do want to deal with this as promptly as we can. So Is there a motion to have a meeting on the 6th at 7 p.m., which will be focused on getting an update relating to I'm just going to give you the right terminology here. It's called the Vermont Agency of Human Services Wellness and Recovery Campus at Goddard College. And to have people from that program and from the state, as well as people from the community for their questions and their comments as well.
Tammy, you want to make that motion?
I make that motion.
Any
Because it
further
was your
discussion?
idea.
Okay, I make that motion. It's a great idea.
Okay, any further discussion from either of you? Okay, all in favor and say aye. Well, actually, I have to go around one by one. So Jim, what is your vote on that?
Yes.
Okay, and Tammy?
I say yes, it's a great idea.
And I will agree. I will vote affirmatively on that. I think that covers things for tonight, and we can take up.
I have a question.
Oh yes, okay.
Did Cindy listen in? Is she taking minutes?
This is being recorded, and so
okay.
we
Well,
can
so
give
somebody
her
has to make minutes out of it.
Yes, yes. It will not be
So
me.
maybe we get. Okay, because Cindy could do it, I guess, if she listens to it.
Yes, yes. So
Okay.
that I arranged that ahead of time.
Okay.
And,
Oh, good. I
and-
just wanted to make sure that there was somebody who was going to be making minutes.
And just for clarification, in terms of the guidance that we received from the Secretary of State's office, the Secretary of State's office said that any school board or select board that was meeting entirely remotely, as we are, has to have a program that where it can be recorded, and also has to have the ability for people to phone in, as you did, Jim, in case they don't want to use the electronic media or they're not available and aren't able to do so. And of course, so those are some basic provisions, and of course the other aspects of the open meeting law need to be applied. So it was good to get that little bit of guidance, not that any of it was particularly surprising, as to what some of the parameters are for that kind of meeting. So we did take a vote on that, and I think that we decide to defer on the approval of the minutes to another time, or is that listed?
No, I thought we moved and approved them already, didn't we?
Did we? I don't remember. Does anybody want to make
Tammy?
a motion to cover ourselves?
I think we did that already.
Okay.
Yeah, I thought we did. Yeah.
Okay. Were you the one that made that motion, Jen?
We did.
I think so, yeah.
Okay. All right. Thank you very much. That piece is done.
Yeah.
Would anybody like to make a motion to adjourn?
Sure, I'll make a motion to adjourn.
All right. All in favor? Or Jim, are you in favor of that motion, having made it?
I am.
And Tammy?
Aye.
And I would agree with that motion as well. And so the meeting is formally adjourned. And I thank everyone that participated. This was a really great turnout from what I could see. I really appreciated it.
Yeah, the other thing I would say is, this was Zoom. I'm not that familiar with Zoom. I've used GoToMeeting in the past, and I like that program okay too. So
I thought
maybe
you
we
might
try
have
that
some
one.
expertise in that. And Amos,
Yeah.
you had a question, and I was thinking maybe we could talk by phone after this. Would that be okay?
Who?
Okay. He gave me a thumbs up, so we'll connect by phone afterwards. Do you want to call me?
Who will? Who's
Amos
going
is
to
gonna
connect by
Balin.
phone?
Oh.
Okay.
Jim, this is Balin. I'm just curious, can you share what your challenge was? I'm just curious.
I couldn't get. I tried to log in with my iPad and I couldn't get on.
Huh.
It
Yeah, because I
wouldn't-
had a little
tried-
bit of a challenge logging
I
in with
gave
my
it the
phone.
number. I gave it the number that was, and I followed all the procedures, but it wouldn't let me in. So I don't know. I have to go back. I have never used it before, and I will look at the training video. I think there's a training video, so maybe I did something wrong.
Yeah, no, it's
Yeah.
funny because I had a little trouble logging in to this meeting for the first time. I hadn't had trouble with Zoom before, but I think it was something with my own internet that was going
Okay.
slow.
Well, I'm in a location with an incredibly fast internet connection, so it wasn't that.
Yeah, no, I'm just curious about it because I've been on a bunch of these different platforms. It seems like more invitations than not I get up from.
Yeah, Well, a lot of people like Zooms. I'm willing to give it a try.
I'm gonna consider these casual conversations since we did adjourn.
Yes,
Anybody,
we did adjourn.
anybody
Okay.
You know what you have, Jim, I think you're writing up what your experience is in GoToMeeting. Lucas Herring also shared one recently. That the more information people can get to us to help us sort through this would be very, very helpful. So,
okay.
Again,
well,
thank you all.
Thanks, everybody. I'm hanging up.
Thank you.
And thank you, Dr.
Okay,
Bell.
bye. Okay, bye.
Bye.
You there, Sasha?
Pardon me?
I just wanted to say thank you. That was great. You did a good job.
So I'm going to give Amos a call. I'm going to hang up here, and Dr. Bull is going to shut us down, I hope. And we'll move on from there. Thanks.
Oh, okay. All right. Bye.
Okay.
You've got Amos right there. You could talk to him.